One example of Apraxia therapy is the 8-step continuum treatment. The goal of this treatment is to move the patient from repeating target phonemes with the clinician to independent productions of the utterances in role-play situations. When guiding a patient through these steps, a clinician must remember the following general rules. Move through the steps at a pace that will allow the patient to be successful. Repetitive drill will be necessary to help the patient relearn the correct motor sequences. Use functional, useful words in treatment. Encourage the patient to self-correct errors. Finally, teach compensatory strategies to facilitate speech, such as prolonging vowels or slowing rate. This is my patient, Miss Glotfelty. Ma'am, look up, please. Miss Glotfelty has suffered a ischemic stroke, which has damaged her premotor cortex or Broca's area. This has caused significant damage to her use of speech. There are 8 sequential steps in the process, but depending on the severity of the apraxia, the patient may be able to skip certain steps. Now I'm going to provide examples of what a therapy session may look like when a therapist chooses to use the 8-step continuum. This is one of our early therapy sessions, so it's very important that the client know his or her name, and Miss Glotfelty's name is Beth. Now what I'm going to do is I'm going to say a word, and I want you to watch me and listen to me. Beth. Now let's say it together. Beth. Okay, Miss Glotfelty, we're going to work on the sound. I need you to put your tongue between your teeth. Yes, and blow air out and make sure that it's a long sound. Good job. Now let's do this again and make sure to hit your sound. I want you to watch me and listen to me, okay? Beth. Now let's say it together. Beth. Good job. Now, I want you to watch me and listen to me very carefully while I say the word. Then we will say it together, but I'm not going to have my voice turned on, okay? Beth. Now say it with me. Beth. Good job. This time, I want you to repeat the word after me. Beth. Beth. Good job. Now we're going to do the same thing, but I want you to repeat the word 3 times. Beth. 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 Awesome. I want you to read this word and say it aloud. Beth. Good. Now I'm going to try to trick you. I'm going to show you the word and then I'm going to hide it behind my back. And I'm going to see if you can tell me what the word was. Beth. Good. This time, I'm going to ask you a question and I want you to answer. What is your name? Beth. Good. Finally, it is important that the patient knows how to use her words in conversation. Therefore, the next step is a role-play activity. My name is Jessie. What is your name? My name is Beth. Good. As you can see, Miss Glotfelty had trouble at the beginning of therapy with her fricative, the TH sound. However, at the end of therapy, we were able to use this sound in a conversational manner.